Okay. Hi, and thanks for joining us here at Children's Wisconsin for our live broadcast. If you're joining for the first time, my name is Dustin, and I'm a member of the Children's Wisconsin communications team. Over the past few weeks, we've been scheduling live Q&A sessions like this one with some of our providers, focusing on ways that we're continuing to support and provide the best and safest care to your kids. Today, I'm joined with Dr. John Erickson to talk about fracture care and why it's so important for kids and teens. As the weather warms up here in Wisconsin, so does the number of fracture cases we treat here at Children's. In fact, between the months of May and October, our care team treats more than 3,700 kids and teens for a broken bone. That's including our emergency department and in our orthopedic clinics. Today, we'll cover what to do if you think your child has a broken bone, the most common ways fractures happen, and tips on how to prevent them, along with the importance of treating growth plate fractures, cast care tips, and more. Dr. Erickson, first off, thank you so much for taking some time with us today. Can you tell me a little more about what you do here at Children's?
Yeah, absolutely. Thanks for having me, Dustin. It's a pleasure to be here with everyone. So my name is John Erickson. I'm one of the pediatric orthopedic surgeons here at Children's Wisconsin. I joined the team last summer in September. My subspecialty focus, other than pediatric orthopedics, is in sports medicine injuries as well as hip preservation, and then trauma and fracture care as well, just like the rest of us here.
Okay, great. I think a lot of people may not know the difference between a fracture and a broken bone. Can you explain what that difference is?
Yeah, I get this question a lot of time in my clinic. I'll tell a family that they have a fracture, and they'll say, "Oh, good. We were worried it was going to be a broken bone." And in all reality, it's the same thing. Essentially, fracture is the medical term for a broken bone.
Okay, well, I stand corrected. That's good to know. Is there a difference between fractures? Are they all created equally? Is a broken bone just a broken bone, or is it more complicated than that?
Yeah, it's definitely more complicated than that. Each fracture has its own concerns, and we need to address each fracture a little bit differently in regards to how we diagnose them, as well as how we treat them, and which bone is fractured, where the fracture is within that bone, the age of the patient, as well as other circumstances are important for determining the best choice of treatment for that patient or child.
With those different considerations that go into what makes each fracture different, are there common causes of fractures that you tend to see over and over again?
Yeah, absolutely. The biggest ones we see in children, being a pediatric orthopedic surgeon, are simple falls, whether from standing height while running or jumping, or from a height where you're on, say, monkey bars or playground equipment, and often injuries like trampoline injuries, all the way from sports, and we even see high energy injuries like motor vehicle accidents.
So we know that these are going to happen. Kids are going to be kids. Accidents are going to always happen, and fractures, broken bones will never go away. But are there some general injury prevention tips that you can share with us?
Yeah, prevention is even more important than treating them. If we can eliminate a fracture from ever happening, it saves that family a lot of stress and time and cost. So simple things that you can do are, when you're riding a bike or a scooter or anything with wheels, really, is to remember to wear a helmet first and foremost. I always joke with my daughter, I can fix your broken bones, but I don't do so well if you crack your noodle or injure your skull. So preventing those injuries is first and foremost. Ways of preventing the injuries that I treat, there's a number of them. Trampoline injuries, as I mentioned, are really common. Trying to have only one child on the trampoline at a time to eliminate impact between the kids, or one kid bumping the kid off the trampoline, that helps. And then just basic safety stuff, like when you're riding your bike, use the proper follow the proper rules of the road. Stop when you're supposed to stop. Look both ways before you cross. And then other things like knee pads, shin guards, elbow pads, stuff like that can help when you do fall. Maybe just bump it or get a bruise instead of a broken bone.
Okay, so a lot of the things that we learned growing up continue to be important to remember instill in our children as well.
Absolutely.
So let's say an accident does happen and, kids have a tendency to maybe not a tendency, but could overreact. What should a parent be looking for if their kid was recently injured and they think they might have a broken bone?
Yeah, it can be difficult to determine whether is this a simple bump or a bruise, a sprain, or a fracture or a broken bone. Things to look out for are a child has a fall or an accident and they're not wanting to use that extremity, whether it's their foot, their ankle, their leg, or their arm, their wrist, or their shoulder. Tenderness to the touch, swelling, and it can go all the way up to times where you have an actual deformity of the arm or the leg. Or sometimes in severe injuries, there can be bone exposed or a bleeding or an open wound. So refusal to bear weight, all those things are really kind of pointed towards potentially a fracture or broken bone and should seek further care.
Okay. I'm just going to interject here to let anybody know that's watching. If you have specific questions from Dr. Erickson, we encourage you to leave them in a comment. We'll have a time for questions at the end of the Q&A portion here. So if a parent does notice symptoms that appear to lead to a broken bone or a fracture, what's the next steps that they should take?
Yeah, great question. So again, it can be hard to determine the severity, but sometimes just a simple look at the arm or their leg can tell you which direction you need to go. For significant pain or a deformity to the extremity, I would definitely recommend going to the children's emergency department to seek further care. We have an orthopedic specialist on call 24/7 to further evaluate and treat that injury. If there's a concern, but it maybe doesn't seem too bad, but you still want to maybe get an x-ray or evaluate to determine if there is a broken bone there. We also offer urgent care, as well as we offer same-day fracture access at a number of our close-to-home locations, including the Milwaukee campus, Greenfield Clinic, as well as our Mequon and Delafield offices.
Okay. So earlier I mentioned that we would talk about growth plate fractures. Can you explain why these types of fractures are important to be treated by a pediatric physician?
Yeah, so there's an adage in medicine that kids are not just small adults. And in my line of work, one of those things that makes that big determination is the presence of growth plates, or open physes, as we call them. The significance is this is an area of the bone that's composed of cartilage, not hard bone that we are typically used to thinking about. And it's an area of potential weakness of the bone. And if that area of the bone, the growth plate, is injured, it's really important to make sure that it's put back together, either in closed means, meaning a gentle manipulation, or sometimes with surgery, so that that bone continues to grow normally. If there's an injury to the growth plate and it's not corrected appropriately, there can be disturbances to the growth, both can result in a limb discrepancy, meaning one limb longer or shorter than the other, as well as angular deformity. So getting that fixed appropriately is of utmost importance.
Okay. So can you explain a little bit about your process in diagnosing a fracture and what a parent who brings their child in should expect if they're coming in for fracture care?
Yeah, absolutely. A little bit of it depends on whether you're presenting to the emergency department or to one of our clinics. First and foremost, it starts with a history and examination. What were you doing? What happened? Did you feel a snap or a pop? Did you notice a deformity? Are you having pain, etc.? And then a physical exam, some gentle palpation of the area of concern, making sure that all the nerves and blood vessels that are in the extremities are working appropriately. And then we'll typically follow that up with a potential imaging evaluation. We typically start with radiographs of the extremity. We typically like to get at least 2 views. Some fractures are difficult to evaluate, especially fractures in kids where a lot of their bone is made up of cartilage, which doesn't show up on an x-ray. And that's another reason why being seen by a pediatric orthopedist is really important, because we understand the nuances of evaluating those x-rays and how to determine when there actually is an injury. Some injuries also require further evaluation, such as a CT scan, which is essentially a 3D x-ray, and sometimes even an MRI scan.
And we have access to all of those imaging equipment and diagnostic equipment at some of our facilities, correct?
Absolutely. We have a number of locations that offer on-site imaging aside from x-rays. All of our clinics have multiple x-ray machines on site. And then we also have a number of sites that offer MRIs and CT scans. I have a number of patients who I'm able to see at 11 o'clock in the morning on a Monday, and oftentimes I can get them an MRI that same day or the following day, just depending on scheduling.
Yeah, I'm sure that's very useful to busy parents and families today.
Absolutely.
So I would imagine that most fractures require a cast. Certainly when it comes to broken bones, I think a cast is what comes to mind for a lot of people. But I know now that there are a lot of different treatment options. Can you talk about some of those different options that people might not think of as synonymously as they do a cast for a broken bone?
Yeah, absolutely. You definitely think cast first and foremost when you think of fractures in children. We have a number of cast options, including materials. Some of them can be what we call regular cast material, which is non-waterproof. We also have cast material that is waterproof, and that is used for certain circumstances, but is welcomed to families, and especially in the summertime. We also have a number of options of splinting materials, both permanent and removable. We have a number of splint material devices that we can actually custom mold to the patient's arm or extremity, such as the Exos splint material and oven, essentially an easy bake oven that you can custom form a splint to a patient's arm or extremity. We have access to walking boots. Sometimes you don't need a cast, or we transition you from a cast to something like a walking boot, as well as sometimes we require further intervention, such as a traction device where we put a little boot on your leg and pull traction to straighten out the fracture, either before we put on a cast or sometimes before we have to perform an operation to stabilize the injury.
Okay. Can you give us any tips for parents on maintaining or taking care of a cast if their child receives it? In what circumstances might they get a waterproof cast versus a non-waterproof one?
Yeah, that's a great question for the time of year we're dealing with. Cast in the middle of the summer can be a real challenge for families. It's hot and kids sweat, and that can affect the cast, as well as kids want to be out there and swimming and playing, running in the sprinklers. Typical cast care instructions include when you have a standard cast on or a non-waterproof cast, it's really important to keep that cast clean and dry. If you're going to take a bath or a shower or attempt to get the rest of the body wet, it's important to cover the cast. There are commercially made cast covering devices that are available pretty easily at a Walgreens, Walmart, CVS, or even Amazon, and those work reasonably well. There's some added cost associated with those. A simple tip for keeping your cast dry during a bath for your child or a shower is to take a washcloth and fold it out lengthwise. I call it hot dog style, and roll it up and wrap that around the upper portion of the cast. And then you take a simple trash bag, a hefty bag, one or even two of them, cover the cast, and you can either place tape or a rubber band, as long as it's not too tight, up around that area, which seals off the water. And if any water were to get in between there, the washcloth collects it and absorbs it before it goes down into the cast. If any water does get into the cast, it's important to dry it out. An option for this would be just to let it air dry if it's at the edges of the cast, or sometimes you can take a hair dryer on the cool air setting, not the hot air setting, and kind of blow it up and down the ends of the cast and help wick away some of that moisture, which also helps with some of the itchiness. As far as your question regarding waterproof casts, these are really nice. I typically reserve these for patients if they only need what's called a short arm cast, meaning a cast that does not go above the elbow. When a cast makes a bend, such as at the elbow, the knee, or the ankle, that's a site where water can collect if it does get in there. So I typically do not use waterproof casts in those scenarios. However, some of the most common injuries we see at any time of the year, but especially in the summer, are wrists and forearm fractures, which can often be treated initially in a short arm cast, which can be waterproof. Or oftentimes your child will spend 3, maybe 4 weeks in the long arm cast, and then the last couple of weeks of immobilization can be done in a short arm cast, which can be waterproof.
Thank you. So kind of making a transition to just more current event wise, we know that there's some hesitation with families due to COVID-19, which we strongly advocate the safety and precautions we're taking here at Children's, but in particular, when it comes to fracture care, it's imperative that we don't delay that care. Can you talk a little bit about what Children's is doing as far as safety protocols in regards to COVID-19 and just kind of underscore the risk of not treating a fracture immediately?
Yeah, I'll actually start with the second part of your question as far as importance of not waiting. Kids heal their fractures very fast, and even within a few days, they can start to heal a fracture. And particularly with growth plate fractures, if you wait more than a couple of days before we can evaluate the fracture and perform a gentle reduction or manipulation or sometimes surgery, it can have disastrous outcomes if we wait too long. Either we're not able to reduce it because it's been too long, or we do so at increased risk of the growth plate, which can have long-term consequences. So for that reason, a fracture is a time-sensitive matter. As far as precautions that we're taking at Children's, I think that as an organization, we're doing a phenomenal job. And probably we were really ahead of the game even early on. So every patient that comes and sees us in the clinic undergoes a pre-visit screening phone call to evaluate for symptoms, any potential family exposures or patient exposures, as well as spacing out our appointments so that we don't have multiple families waiting in the waiting room together. We try to space it out so you're either yourself or maybe one other family in a large waiting room so that we're not overlapping potential exposures. As far as any sort of surgical procedure or an MRI or a diagnostic test that needs to be performed, those patients are undergoing a pre-imaging or pre-surgery COVID test, a nasal swab, to verify that they are in fact negative so that we can safely bring them into the hospital to be around our other patients and healthcare providers and do the procedure. Or if positive, we know to take particular steps in treating that patient to decrease the risk of further exposure.
Great, thank you. Along with those actions, we have a number of other precautions that we've taken, from social distancing in our waiting areas, along with mandatory employee screenings each shift. All of that will be available in the video description after we finish this live broadcast at our safety landing page on our website. So before we get to any questions that were submitted, is there any final things you'd like to share, Dr. Erickson?
No, not really. I welcome any questions that any viewers have. I think that we're doing a tremendous job during this extraordinary circumstances that's going on. It just happens that we're coming into the summer season, and pediatric orthopedics, we call it fracture season, because kids they're out and about and they're active and they want to do the things that they enjoy doing, and along with that comes potential injury. And I think that if this does happen to your family or your child, I think the only place you should bring them is Children's. We're fully capable and we have all the experience, and we have cast techs that I joke with them, they put on better casts than the surgeons do. We have such a great team here, and everything that we're aimed at here, both at Children's and in particular in the pediatric orthopedic division, is really set up to take care of your child.
Great. I don't believe we've had any questions come through, though plenty of people will watch this video after we've broadcast it live. You should still leave your question in a comment, and we will get it answered either by another staff member or Dr. Erickson himself. So with that, thank you so much, Dr. Erickson, for taking the time with us today. As always, to any of our viewers, if you have questions about Children's Wisconsin, fracture care, our response to COVID-19, or anything else regarding your child's health, please visit childrenswi.org. You can find all kinds of resources there, from details about our locations to blogs on how to talk to your kids about COVID-19, how to prevent fracture care, or fracture injuries rather, and tons of other content. As I mentioned earlier, we'll be updating the video description with links to some of the resources that Dr. Erickson spoke of earlier as well. And remember, if your child needs medical attention, we are here with our telehealth options, including Children's Online Urgent Care. There are numerous ways to get your child the help they may need. All of our locations are taking the necessary precautions to keep you and your child safe. and make it through COVID-19 and our summer fracture season as well together. Thank you so much for watching.